Look at me. Right, this is day one. Basically, I had my thing yesterday, but I didn't want to do a video yesterday because of the pain. Not the pain, it was just my head was swollen. I can't move it like too quickly. I can't really do too much, so waited for the morning after. Yesterday also this was a bit more bloody, but I'm going to go into everything that we basically done. So we turned up, places in Paddington. I think it's called the Hair Growth Centre, HGC. So basically turned up at 7 o'clock in the morning. I had to have my consultation, basically just sign forms, basically agreeing, stating any medical stuff that they already know, they're just confirming it. So then met, I think, with Dr. Masood, I want to say, from what research I've done, I think his name's Dr. Masood, but if I'm not right, then I will put it down. So he was just taking me through everything. Then he started drawing out my lines, basically on what area they were going to work around and basically put all my hairs into. So he started marking it off, which I think I've got a picture of, so I'll upload that. And just went basically around. Now here, obviously it doesn't look like it's done. So here I think they've shaved from what I can see when I look in the mirror. Here, that's under here as well. They basically told me in the consultation that I've got an artery there, or a tendon that links to my eye, so they don't want to go anywhere near that because obviously that can just lead to really bad complications. So that's absolutely fine, but they said what they're going to do is thicken it a lot there so you wouldn't even notice. So that's fine, it works. I'd rather that than make any more damage to me. About 8:30 I went to go and get my hair cut. So basically, let me just show you the area. It's obviously still bandaged up, so all along here. So under that, she's just given me a proper shave. Parted my hair, shaved it off. I've just had my hair shaved. Had my fresh trim. Went through to the actual place that I was having my operation, and there was a lady in there who was basically going to use the FUE machine and take out my hair follicles, basically, and put them aside. So I got in, she made me comfortable, asked if I needed any water before we started, etc., toilets, whatever. So that was really nice, and it was like, made me really comfortable. So there was like a massage chair with a hole in, so I had to go and lay face down and put my head in this hole. So she then started to say, oh, we're going to do the anaesthetic now, so it's going to be needles, etc. So I was like, okay, that's fine. She was like, it does sting a bit, and I was like, after reading reviews previously, I was a bit nervous just because they were saying it stings and it's really painful, but it's literally, like she says, a sharp scratch. And once she's actually put the first lot in, it numbs everything else, so you don't really feel it. But anyway, face down, and she's in the back just injecting it. So afterwards, she started doing a test with the same needle, just tapping it, just to make sure that I couldn't feel anything. The sides here, just behind the ear, when she was doing it, it's probably the most painful bit, but again, not that painful. Not that painful. I think that anaesthetic's still in my head. But then, yeah, after that was done, I could still feel a little bit, and I said to her, listen, I can still feel a little bit, and she was like, that's fine. She just put a bit more. She was like, let's just wait a bit, let it kick in, and we'll go. That was fine, made me comfortable. So she starts, I hear the machine start. Anyway, I actually had asked to have a look at what the machine looked like, and it looks like a tattoo pen almost, but instead of having a needle on the end, it's like a really small hole. So she said that she puts it in, it goes into the head and comes out, and basically it extracts your root as well as a bit of flesh around it, and then they put that aside. So I was like, right, okay, I don't really mind things like that, I'd rather know what it is. So that was fine. So with that, they take out multiple hairs with the root, so they target more the ones that have like 2 hairs from a root or 3 hairs from a root, etc., rather than just having 1 hair per root, because otherwise that being put into here is going to be a long process. I basically I actually fell asleep. Not fell asleep completely, like, but I was in a nice relaxing state. So she was asking me every so often to kind of move my head in a direction that made it easier for her. I then had these doctors coming in and saying, oh, we're going to take this, that, and I think they were just doing things in the lab. So after that done, that probably took about 9, 10, 11, maybe 2.5 hours, I think. And then when that was done, I kind of got up. She was like, right, just take time, it's going to be okay, we're going to flip you round now and we're going to start putting it in the front. So I was like, right. I said, so with the needles that you've used, not the same needles, but the same anaesthetic that you've done in the back of my head, is that what's going to happen at the front? And she was like, yeah. So I was like, great, okay, because obviously this is a lot thinner, and I think this is just a bit more like, you can feel more here than I would at the back. So she starts putting it in all across. She's like, you're doing so well. I'm like, thank you, thanks. Obviously it's getting number and number. Well, so I thought. Then they start doing the test, and I can feel like the needle like going around. I'm like, I can feel that. Like, I can feel that. So that's absolutely fine. So like towards the backs it was fine. It's just more across this hairline bit and down the sides that I could still feel it. And then he was like, some patients it doesn't kick in as quick, so what we do is we use another thing. So it's still an anaesthetic, but they were just putting it here, just above my eyebrow, and he said this is going to sting like hell. So I was like, great stuff. But again, it wasn't actually that bad. It did make my eyes water, and I had to like clench my fist and go but that was fine. So yeah, after that had done, he said that it's going to both of them are going to sit here, and basically the anaesthetic's going to be pushed upwards. So I was like, okay, that's fine. So about 5 minutes after doing tests, that's fine, we're good to go. And then they basically, from what I can't feel it obviously, I could only hear it. So I can hear and I'm hearing, I need a blade. So then the doctor was like, right, Ashley, what we're going to do is just make small incisions in your head, and this is basically going to make room for all the stuff that's been taken from the back of your head to sit now in the front. So this doesn't damage anything from the back, by the way, because that's just going to grow back. That's not a problem. That's not going to affect anything. So I can hear him like and it's not uncomfortable because again I can't feel it. So yeah, he's going in. Then they wrap up my head, so I'm done in terms of getting my incisions. So I'm ready for everything to go in. They're like, right, it's time for your lunch break, which was about 1 o'clock. Time for your lunch break. Obviously they took down in my consultation what I wanted, so I opted for a chicken salad, orange juice with bits and crisps. So then afterwards I FaceTime my mum while I'm having a wee. Hey mum, look at me. So I wash my hands, go back to the room, have my lunch there. So I'm still on FaceTime and everything. Nurses are coming in and out, but they left me in the room just to eat in peace, which for me I preferred. I don't really want to be going out to any rooms. I just don't want to move, to be honest, because my head feels like out here. I feel like it's hard for me to keep my head upright anyway. So after my lunch, it took about half hour, and they were like, we're good to go if you are. So I was like, I'm good to go. So I sat back down, and this was the part, I had 2 doctors either side, so I'm like sat up, 2 doctors either side, and they started from like the side up, and the other one started from here to here. So I actually fell asleep for most of that. I actually got woken up by hearing Ashley. So I was like, I've just woken up. Whatever. They were just asking me if I'm okay. Basically, there's not long left, and how they were so happy with how it's looking at the moment. They were like, it's been really, really successful so far. You're going to be here for maybe an extra 20 minutes. So that's fine. So they must have got to a point here, but then realised I needed a bit more. So I was down for 2,500 grafts in total, which is about 5,000 hairs. But what they done is they took another 300 grafts so another 600 hairs, let's say, and took it from the back again to then put in the front. So that took an extra, it probably added about half an hour onto the actual time itself, but again, it's not that bad because I can't feel anything. So yeah, that had finished, and I woke up, well, I got up and I was like, just be slow, have this drink, and then what we'll do is we're going to get you changed, because I just had my vest top on, but the back of it, because they're constantly spraying it because they don't want it to dry, the blood is dripping down, like, and going all over my back. So by the time I'd finished, my whole back was just soaking. I was a bit cold, but they do offer, if you're cold, they do offer blankets, which is cute, I think. At the beds, I have to do it like this because I can't turn like this, and it's all bloody, but they're wiping it down and they're like, just don't be concerned because it's water and blood, so obviously it's going to go a bit more everywhere. And I was like, listen, things like that, it doesn't bother me, to be honest. Like, it's part of the procedure. I can't say that I haven't watched other people's blogs and they've kind of stated the same thing. So I did actually bring home, it's a bit weird, I don't care if you think it's weird, but I'm going to donate this. It's highlighted hair, I tell ya. Highlighted hair. I don't want that to come out because, to me, I just don't want it to come out. That's it, end of. So that's going to be donated. Obviously after the operation they give me some aftercare bits and pieces, so I've got like bits of dressing that I can clean myself up with, so bits like this. I'm going to just dab it on there. Obviously this is all dried up and everything. I don't know if I've actually shown you the final result. So that's everything that they put in. You can see all the little punches. It's actually quite fascinating, really. Like, if you think about the whole procedure, obviously I've got little bits of hair here, which is the front part, but they've shaved most of it just to make it easier for them to actually work around. I've got to keep this band on for 5 days, and I'm not allowed to cover my head for 10 days, so I'm really going to struggle. I'm meant to be going back to work in about 4 days, but honestly I don't know how I'm going to do it. Obviously I feel better that everything is done, but it's still, this is why I wore hairbands, to cover this. So I don't really know how I feel going about things without it. I don't really want to, if I'm honest. I'm just going to lock myself away, but what can you do? I've got all these different medications that I've got to take. I think for 5 days I've got to take that for. So that's to help with swelling and the process of things. I've been told I need to sleep one of these at night and sleep at like a 45-degree angle. Then after the consultation, thank you. My mum's just brought me tea. What a G. So after the consultation, they basically like said, you can have these injections, which they recommend. It's something to do with plasma and thickening up all your hair and making it a lot more dense. So he said, listen, I'm not trying to force you into anything, but, which I didn't feel they were forcing us into anything at all. But this is this is for life. Like, if you want it to look that bit better, you can go down this route, and then you're sorted for life. You know, like, you're gonna have thick hair, you wouldn't even notice. So I'm like, why not? Why not? So anyway, I had to have they took a blood test from me, and then about 10 minutes after that, they came back with plasma. And I don't know if they took it from me to then separate to be put into my head. Either way, it's good for me. That's what it matters. But after loads of injections as it is, they were going to inject it into my head again. Same process, but I still obviously had the anaesthetic on, so I didn't feel it as much, but it was starting to wear off. So that was that. But yeah, these are my results, and I'll do videos every so often just so that you can start to see exactly what's going on. Tonight I've got to take the bandage off, and give that a little clean. In regards to my hair washing, I can start doing that from day 3, I think, but I've got to use baby shampoo. So what they've done is given me this, I'm due a spray now, so I may as well. I have to do this about every half hour. Basically, they just want me to spray it on. This is saline. Basically, when this runs out, they said I can use mineral water just to spray. It's just to keep it like moist. I've got to use baby shampoo, I think, for about 2 weeks. So that's fine. But he said that he wants me to spray it because obviously you can't be scrubbing anything because everything is still loose. So it needs time to be able to like get in and everything like that. But otherwise, I'm really happy with how things are going. Obviously, I don't look good at all. Like, this is so bad. Look at how swollen my head is. So that's what I've got to deal with. But I'm not going out, so no one's going to see me. And I'll only post this once I'm actually seeing a bit of results. Just because that's just where my confidence has been affected, I think. So I'll do it on my own terms. But yeah, otherwise I'm excited to see how every day is going to look. But yeah, no hair, still smiling. Let's do it. In a month, it should have grown about 1 centimetre. In a year, I should be looking like Rapunzel. So, whoa.